Ann Arbor.
It is Ann Arbor.
It is Ann Arbor. But reclaiming my time, the problem is, if we implement this kind of national health care plan, my colleague will have an advantage.
How's that?
America's escape valve will become Cuba. And you're closer to Cuba than what we are. That's the bottom line here.
A very encouraging thought. Is this time not a medical doctor, but known for his seniority on the Intelligence Committee. So we have a guy who's intelligent. Please join us, Congressman Hoekstra.
I thank my colleague for yielding. I hate to correct my colleagues, but that's not what happens to everybody in Canada. Being a border state, we know another thing that happens in Canada, that when a Canadian goes to their doctor or their hospital, or is determined that they need treatment, and that they're going to be down the list, instead of hoping to someday to go to the hospital, in Canada, when you get sick, a lot of people go to the airport, or go to the bridge, or they go to the tunnel, or they go to the border crossing. In Michigan, they go to the bridge or the tunnel, and they come from Windsor and other places in Canada because they come to the United States for excellent health care. So they do have another option, and it's called American health care.
The gentleman.
And write them a check for the work that they do there. Because the Mayo Clinic recognizes what this is going to do to them. They came out, foursquare opposed to this plan.
So not just doctors now, but the Mayo Clinic is opposed to this scheme that we have seen concocted here.
Because I think what they recognize is the scheme up there will take a Mayo, and rather than allowing Mayo to continue to lead the world and, along with these other institutions in the United States, to provide quality, excellence, innovation, and research in treatments that are shared with doctors and hospitals around the country and around the world, I think what they say is, well, that threatens us at Mayo, and we're no longer going to be able to provide that. So I think we need to make it real clear what Republicans are for and against. We are against that chart up there.
Massive
we are
bureaucracy.
for high-quality health care.
I think that's a very small business. I'd like to go to my
yeah.
Hoekstra.
Well, I got another category that I think may not be on your list.
Yeah.
I just had the opportunity to watch the president deliver his speech on health care and then answer some questions. And very interesting that the plan that the president was describing is not the plan that we find in the House of Representatives today.
Or the Senate?
Or the Senate. And so then the president, in the questions or whatever, the president said, well, let me tell you about the new areas where we have agreement. Now, again, this was agreement among the Democrats, not the Republicans. And I think you know that the Energy and Commerce Committee is going to go back to work tomorrow marking up the bill, this health care bill. But it looks like there are now massive changes that are being negotiated, that are being feverishly written into law tonight and over this coming weekend, because this House is on a mad dash because there's an artificial deadline. It has to be done by August 1.
So by August 1, we're going to take 20% of the U.S. economy and turn it over to some czar, or commissioner, or commissar, or something. And this is the flow chart of what's going to happen.
No, it's not the flow chart anymore.
Oh,
that's the flow chart today.
That's the flow. But tomorrow there'll be a different one.
So the other people that won't like this, because that flow chart is changing as we speak. The other people who won't,
it's already giving me a headache. But
yeah, the people who won't like this are people who are saying it's 16 to 20% of the economy. Let's go through this in a professional way as we write this legislation. Let's make sure that we deliberate it. Let's make sure that we understand these consequences that just magically appeared today, and give us some time to digest this, because at the same time that the president is saying this group likes it, that group likes it, this group supports it, it's all of a sudden it's a whole new plan. And so by tomorrow afternoon, there will be, I expect, a new plan on the floor of the Energy and Commerce Committee that nobody in the committee will know what's in it except for maybe one or two people. So people believe that we shouldn't rush into messing around with their health care and with our doctors and our hospitals, and that we ought to be very deliberate, and that they would like us to know what's in a bill before we vote on it, and they would like to know what's in a bill before they call, so they can call us and tell us what they like.
Are you trying to tell me our constituents actually want us to read the bill and know what's in it before we vote on it? Now that's a novel.
I did a teletown hall meeting tonight, and there were two areas of questions all night. Number one is, where are the jobs? You know, I live in a state that has 15.2% unemployment. They've seen that we spent $800 billion. They're saying, Pete, where are the jobs? Where are the jobs? Where are the jobs? Because of the impact that it's having on their families, on their kids, and those kinds of things. And the second category was, don't mess with my health care, or don't mess with my health care until I have an opportunity to review it and see what it's going to do to my health care. And, you know, don't vote on anything that you haven't had the opportunity to read and review and to explain to us what it will do to us.
Well, but reclaim my time, going back, they take away those rights.
I think the gentleman hits it right on the nose. Because the alternative to that chart is freedom. Is freedom by the American public to be involved in their health care. And if we vote in this massive health care, what we are doing is giving up exactly what the gentleman described. We are giving up our freedom, and we are turning it over to this town, to this building, and to that bureaucracy.
I don't think so, and let's hope they don't rescue health care the same way. Gentleman from Michigan.
Just before you took over and joined us in this special order, my colleague was saying, you know, that this doesn't do much for the unemployed. I think we have to recognize that it does. I mean, for those people that are in the unfortunate circumstance today of being unemployed, one of the things that they are concerned about is that they don't have access to health care. That plan may provide it, but the other thing that I think has been pointed out, this plan will hurt the economy and hurt more jobs. And what these people want is they want the opportunity to get back to work. And I think under the Republican proposals that we have out there, we have ways for people who are in that unfortunate situation of being unemployed through a tax credit or whatever, to be able to go out and to buy and to have the freedom to choose a health care plan. So, you know, I think that's now becoming a selling point of this new plan. It says, well, if you're unemployed, and they're creating a lot of them, you know, we're going to be able to provide you health care. But the Republican plan will do the same thing, because we do believe that it's important that everybody have the security of having access to health insurance. We just don't think you have to create this bureaucracy to do it. So let's not forget about the people that are hurting, who are unemployed, but just because they're unemployed doesn't mean this system is what they need. There are better alternatives.
With the gentleman yield.
Yeah. Point. Because there will be some people who will keep their health care. Who will that be?
Well, Congress.
It'll be
in Congress.
It'll be federal employees and Congress. Congressmen and senators will keep their health care, because I believe in the Senate there was a proposal, there was an amendment that was voted on, and I hope that we have the opportunity to vote on this in the House. Because in the Senate there was a vote that said, we're going to put all federal employees, including members of Congress, into the public health plan. The plan that we will force millions, what was the number, 73 million in the first 5 years or something? That we will force...
It's over 100 million, actually.
Okay, 100 million people into. We're going to force them into the public health plan. But when the vote came up, and I'm not sure if they had one in Energy or Commerce on this amendment yet, but I think it's coming. But when that vote was held in the Senate said, we're not going into the public health plan. We're going to keep what we have. And so it's fascinating to say, we're ready to, you know, for the Senate to say, we're ready to force 100 million people in the public into the public health plan, but we ain't going there. That tells you what the Senate thinks of what will be the public health plan. I thank my colleague for yielding.
Well, let me